There you go.
I had had a stroke in 1995, and that stroke rendered me extremely dizzy. I've been in my body for 43 years, so I just seemed to know when I was improving from the original stroke, and then all of a sudden I was starting to feel dizzy again, so I thought there was something going on.
Good.
When I talked to my doctor, they all said, well, you have to realize you had a brainstem stroke, and it's going to render you dizzy at times, and it's going to affect your equilibrium, and I'm sure that is what this is. That's what you're feeling right now. You're feeling the effects of the original stroke. And I kept saying, I don't think so.
Did you see this?
Not accepting his doctor's verdict, Pat approached UCLA's brain attack team.
Hey, Pablo, how's it going? Gary, good. Were you able to reconstruct?
The team, using this state-of-the-art computer imaging technology, CTA, scanned Pat's brain and then was able to reproduce it three-dimensionally on the screen.
Through the CT images, we're able to make an exact three-dimensional image of the patient's brain and vascular anatomy with measurements that are sub-millimeter accurate. Previously, the only way to really find out what was going on anatomically was to perform the neurosurgical operation, open up the skull, and literally check in the patient. Now we can do that same checking procedure non-invasively through the use of 3D imaging.
What Pat's CTA scan revealed was that the two carotid arteries feeding blood to his brain were severely narrowed through disease.
I was told that I only had 20% blood flow to my brain.
We'll start with the 3D image here.
Oh, that's a very nice reconstruction.
Let me rotate a little bit. And this shows both the left and the right cervical internal carotid arteries as they go up into the skull base. And here you can already see how irregular these vascular segments are. But here you can see the sort of beaded appearance to the artery. That is an indication of the degree of disease that it has. And in this particular area, you can see how very narrowed that segment has become.
If I had some kind of blood clot or something like that, it would occlude the artery completely, and it would be catastrophic.
Brady, you want an ice cube? We didn't know what was happening. We felt he was a time bomb. He felt at any moment something could happen, and we really had to stay close to each other. And there was just this horrible anxiety that we all felt, that it could today be the day that something might happen, and just this fear.
French surgeon Dr. Pierre Gobin, a member of the UCLA brain attack team, operated on Pat Visciglia in February of 1999 in an attempt to open up the collapsed carotid arteries on either side of his neck.
On the right side, they were able to use a coronary stent. A stent is a titanium device that's put in to act as scaffolding, if you will, in the artery wall.
This area had been quite narrow, and we placed a stent, and now it's normal in caliber.
In UCLA, obviously, as far as I'm concerned, saved my life. The operation went beautifully. I mean, I was feeling great, and then a couple weeks ago, I started feeling a little dizzy again.
Dr. Gobin now decided to operate again on Pat's left carotid artery, which in the previous operation he'd been unable to stent because of its shape.
So this patient has a very narrow stenosis of the internal carotid artery. In this portion here, you can see the stenosis. And this artery is absolutely vital for him. So what we are going to do, we are going to place a balloon right into this area across the stenosis, across the narrowing, and inflate the balloon to give a normal diameter to the carotid artery here.
This is the actual balloon to be used in the procedure.
You can see it has a tip. So along the orange segment, the wire will run along the inside, or the catheter runs over the wire. This balloon here is about 4 millimeters in diameter. So there's the balloon inflated. And so by inflating the balloon within that artery, we expand that narrowed segment.
You know, it's truly amazing because I don't feel that I have anything to worry about. I mean, maybe I'm stupid, but I really believe that with technology and the things that are going on, my attitude is, okay, this is what we did before, now we're going to do this.
Make you feel more comfortable than you already seem to be.
I guess I'm pretty relaxed, pretty confident. Just like at home.
All right, hold still.
You turn the steam on, Almas. We are going to give a little shape to this catheter.
This may be a high-tech operating theater, but innovation still has a role to play.
So we shaped the catheter, we gave it a little curve, and this will help us to negotiate the brain vasculature.
Now we start by putting some local anesthetic in, and to make a small incision in the skin. To access the artery, use a small needle, and then through this needle we'll place a wire into the artery, and then over the wire a catheter. So this exchange wire is a little over 2.5 meters in length, because to access from the groin to the brain, it's about 1 meter, and that's the length of these catheters. So you're going to go with the microcatheter first, or?
Yeah, I think it's safer. No?
Yeah.
You agree?
So what we've done now is we placed our guiding catheters into position in the carotid artery. We can see there's a line inside the artery going up into the blood vessel in the brain. Advance the wire, please. And now we're placing a very soft, supple microcatheter beyond the area of narrowing. This allows us to put a very soft system across that narrowed segment, and then through this small catheter we'll place an exchange wire, pull out the small catheter, and then over that wire place our balloon to inflate the area of narrowing. We are now advancing our balloon catheter over this wire that's in place in the cerebral blood vessels across the level of stenosis at the base of the skull, base of the brain.
Much slack here. So our balloon here is across the narrowing, across the stenosis.
2 markers of the balloon.
And we are going to inflate the balloon. 1, 2.
Perfect.
Balloon
Perfect
inflated
location.
at 2.
Yeah.
Okay.
It's very stable.
Yeah.
So we're inflating the balloon now. We're going relatively slowly with the inflation to not cause damage to the artery.
I'm going to push a little bit more. The balloon is inflated now. Huh? It's perfect.
Looks good.
It's great. It's good.
So the cerebral vessels look fine. Do you want to pull everything and do another angiogram?
Yeah.
Okay.
I think we can put everything now.
Yeah, I agree.
With the narrowed artery now successfully expanded by the inflation of the balloon, Dr. Gobin deflates the balloon and withdraws it and the guide wire from the brain.
Yeah. Okay. Very good.
Oh!
You're supposed to go deep.
Life in the Visciglia household in Los Angeles is also returning to normal a month after Pat's successful operation.
Oh, yeah! Oh! Too bad.
I think after his surgery, when it was over, we all just sort of went, this weight had been lifted off our shoulders that, gosh, you know, we're not as worried. We don't have to think about this anymore. And it was overwhelming, just the freedom that we felt.
There you go. I'm feeling a lot better. I'm feeling much more confident every day. And I think that's basically what you feel. I mean, some of the dizziness is going away. It's a gradual. It's not like you have the operation and the next day you feel great, so it's going away. And I'm starting not to even think about my condition, which is a wonderful thought. Ready to walk?
Good job.
Oh!
Oh, it's on!
The technological advances are unbelievable. Thank God we live in the age we live in, and we're seeing stuff at such a rapid pace. I believe there's something down the road that if something came up, Dr. Goban or UCLA or Dr. White or the people that I've been seeing have the wherewithal to help me. And that's a very comforting feeling.
Like 3.
Pat Visciglia owes his life to a team who, like their contemporaries at more and more hospitals across America, are waging a full frontal assault on the medical threat of stroke. An assault that is driven by the mantra that time is brain.
Acute stroke units, brain attack teams do improve stroke outcome.